Hello, and welcome to the Paging Dr. Cohen podcast with your host, Dr. Gordon Cohen, MD, PhD, MBA.
And so my goal is to make medicine as understandable as possible. No funny language, no complicated verbiage, just plain old conversation.
Let's call him the doctor.
Paging Dr. Cohen.
Seattle's Morning News. Dave Ross with Colleen O'Brien and Chris Sullivan. Here's the last thing you wanted to hear. That new strain of coronavirus has appeared in Snohomish County. Let's call in the doctor.
Paging Dr. Cohen.
Dr. Gordon Cohen, MD. So we talked about this a few weeks ago. At the time, there were about 1,000 cases in the UK. And now, where are we at?
Within just a little over a month, that mutation of the virus has become the dominant strain in the UK. And it's expected to be the dominant strain in the United States by March. Now, currently, as of Friday, there's only been 195 cases detected in 22 states within the United States, now including Oregon and Washington. Having said that, it's probably much more widely present. It just hasn't been identified.
Is the vaccine that we already have at all effective against this?
It's more than just the vaccine, but it's also whether or not the antibodies that people who've had the disease are capable of fighting off these new variants. And we do know that coronaviruses do not produce very strong responses. If you recall, we've talked about the common cold often caused by...
That's why we get it every year, because it keeps changing.
Exactly. And that's what's happening with this coronavirus. And so this new variant from the UK it's called B.1.1.7. It accounts now for over 60% of all the coronavirus cases identified in London. It appears from studies that have been done so far and from other information that the vaccine is effective against this British variant. Pfizer has done a lot of testing and been able to demonstrate that that's the case. And Moderna is in the process of doing that right now as well.
Okay, so that's good news. At least there's some defense against this new UK variant. What about the South African variant that we're now hearing about?
We're not so sure yet about the South African variant. There were 21 of 44 people who got the coronavirus in the first wave of infection in South Africa. And unfortunately, their antibodies didn't actually recognize this new variant. So this isn't definitive proof that the variant can escape immunity, but this is why it's being tested by the vaccine manufacturers.
Okay, so you've been talking to people about the whole vaccination process. What have you discovered?
People who are older, my age, who are at some risk of getting it, who are healthcare workers, we're quite anxious to get it. But I'm talking to a lot of other people who are younger healthcare workers who are in their 20s or even 30s, and they have a lot of skepticism about getting it, which was somewhat surprising to me. But that's also the group of people who are least likely to get very sick from it. But they're also the group of people who are most likely to spread it. So it does create some concern for me. And the other thing is, when I've talked to people who are outside of the healthcare field in all different age groups, there's still a lot of skepticism about the vaccines themselves. And, some people even have used the word guinea pig. I don't want to be the guinea pig. I want to wait and see what happens. And so I've even talked to people who are in their mid 40s who said, I don't want to get it. I'm not sure that we know enough about what's going to happen with it. And so I'm just going to wait. Well, one of the problems with that is that it becomes a real challenge to this whole notion of trying to deliver 100 million vaccines in 100 days. I even think, given the attitudes of just people I'm talking to, both in and out of the healthcare field, and this is not obviously scientific, but it is representative of how people feel to some degree, that there still has to be people who are willing to stick their arm out and get the vaccine. And I do sense that there's some degree of skepticism about whether or not they even want the vaccine in the first place. So having said that, if we got 67 million people vaccinated and we had over 100 million people who had been exposed before, that'd be roughly half the population who would be immune. And I think we need to be honest about it. I think with these evolving mutations, we are going to be, social distancing, focusing on good hygiene, and wearing masks probably for the vast majority of this entire year.
Let me ask you this. Once everybody has had the opportunity to get the vaccine, are we obligated to keep the economy closed to protect those who refused vaccination?
Well, I mean, I think it's a challenging question, right? Because the argument is going to be, I think, on the other side is, well, we don't even know if the vaccine works. And I mean, I think that vaccines are really a public health issue. And I think there's a strong argument for almost, I hate to say this, but almost mandating that people get vaccinated, because otherwise, I don't know how we get out of this mess. Again, I'm going to say, like I've been saying all along, this should not be a political issue. It's hard to eliminate politics from it, but this is a public health issue. And I think we have to do everything we can as people who live in a society to help protect ourselves and protect our fellow citizens.
Dr. Gordon Cohen, MD. Dr. Cohen, thank you.
Thanks, Dave.
Today's episode of the podcast is brought to you in collaboration with the American Heart Association. Please visit heart.org and consider giving a donation by clicking the Donate Now button in the top right corner. If you enjoyed this episode of the podcast, please tell a friend, rate, comment, and subscribe on Apple Podcasts, Spotify, or wherever you listen. Stay up to date on Twitter using the handle Paging Dr. Cohen, or simply send us an email with any comments or medical questions to podcast@pagingdrcohen.com. Thanks again for listening, and stay safe.